Mine wasn't a traditional route. It was my papa. He was a pastor. I didn't have anybody in my family who was in anything in the medical field, especially no one in nursing, but he was a pastor and he was a counselor. So I consider him a healer because he had a love for people and a peace that I say that was beyond this world. So he was probably my biggest influence, that and my mom. My mom ministered through song, so, and that's part of my name. So it's kind of that both of them combined, but mostly my papa. When I was younger, my mom didn't know how to deal with my curiosity. I had a lot of questions, and she was a single mom for the most part, and I spent a lot of time with my grandma and my grandpa, my Mimi and Papa. So she tried her best to answer my questions, but from about as far back as I can remember, the careers that I wanted was something in at first I wanted to be a doctor, I thought, when I was a little kid. And then it just kind of changed. I kind of got lost in the shuffle, I'd say, when I became an adult because there wasn't anyone. They talked about the early exposure that probably would have helped me in my career and picking what I wanted to do, what I wanted to be. Because I started college not really knowing what to do. I just knew I wanted to be somewhere in a hospital setting or a medicine setting. The doctor thing didn't quite work out. Then I had my kids, life came along, and it was a really good friend of mine who mentioned nursing. I was at another customer service job I had, and she told me how to apply. And I owed other schools at the time for mistakes I had made in my past, grade-wise, because I didn't know how to navigate that road. So mentorship to me is really important because I see how that could have helped me probably navigate a lot better. But I just had an interest in helping people from when I was younger. And then, like I said, my papa's influence, that's how he was with people, and I spent a lot of time with them. There's actually been quite a few. Of course, when I worked in a tribal facility, it was advocating for needs of the Native patients there, because a lot of nurses, a lot of doctors, a lot of staff are non-Native in tribal facilities. So I feel like there's a communication barrier, understanding the culture. But then even when I worked on the road, probably the one that comes to mind most that just really made me think about, because COVID came close to taking me out of the career. I saw a lot more death than I signed up for. I'm in the critical care setting, so it was expected, but that hit hard. But there was one in particular. He was a 46-year-old man. He had been in the military, so he was obviously very physically fit, took care of himself. He got COVID. He ended up on ECMO. He had been on ECMO for about 2 months. I was a travel nurse at the time in Florida, and I had just floated to the cardiac unit, and he was there. He was waiting to be discharged the next day to go to a rehab and then eventually go home. So he actually survived, and I couldn't believe it. When they assigned me to him, I was just almost crying because I had seen very few, probably one other patient who had actually come out of it, and they still didn't have a good outcome. So to see him, I was very emotional going into it, but he was having a hard time sleeping. He was very anxious. He didn't know what to expect. He was still very, very, very weak. He knew he had a lot to catch up on physically, and he knew it was going to be an uphill battle. And so I remember going in the room, and I gave him all the meds, gave him all the PRNs I had available, and he still wasn't comfortable. He still had his call out. I'd come in there to check on him, and I had told him, anything, you want anything, you let me know, because he had survived. I hadn't seen that before. So the last time I went in, I told him, I said, you know what? I said, I don't have any other medicine to give you, but here's what we can do if you're okay with it. His wife had left for the evening. She had to go home and take care of their kids. They had 3 kids. And sorry, I still get pretty tearful about it. I said, we're going to massage your legs, because he had restless leg on top of everything else, and I believe it was due to all the nerves and everything that had been affected by COVID. I said, I'm going to massage your legs, and as I do it, just know that I'm praying over you. And if it doesn't help, that's okay. We'll try something else. So I did some passive range of motion exercises with him, and I prayed over him while I was doing it. And then I let him know, I was going to let him rest. We'll see if it works, to let me know. He rested for about 3 hours, and then he hit his call light again when he woke up, and he was crying, and he asked me if I could do that again. And I said, I sure can. I said, I promise you, anything to get you home to your kids and your wife, I'll do it. So we did it again, and he slept again for a pretty extensive amount of time. I don't remember how long. And then at the end of my shift, I prayed over him again. And I knew what he was going to face when not exactly, but I knew it was going to be an uphill battle. And because me and my husband, we were both travel nurses at the time, and about a month later, another cardiac nurse that we had made friends with, we met up for him, and met up with him for dinner one night, and he pulled me aside and he said, Taloa, I got to tell you something. And I said, okay. And he said, do you remember that guy that you took care of that was going home after COVID? I said, yeah, how could I ever forget him? And he said, his family wanted to thank you. And I said, okay. And because that cardiac nurse had stayed with him through those months. He had found out what football team the guy liked, to try to activate his brain activity, talk to him while he was doing ECMO, while he's doing the things in the room. And the wife really appreciated him. So he had gone to their house to visit. And that man said that gave him such a peace, that and it helped him rest, and it helped him think about what he needed to do to prepare himself when he went to the rehab and went home. He was scared. And he didn't know quite what to expect, but he remembered that I did that. And when we're just doing the things that we do, it's not like we're doing it for any prize or anything. Like, I did it because he was a survivor, like he had survived death. And that was a big thing to me, for him to get to go home to his family, because I'd seen so many not be able to do that. And that probably was like the biggest thing. And it made me feel like what I do is actually important. Like, the little things that we do are very important. Even the way that we each bring different gifts to the table, and different ways to solve problems, different ways to talk with patients, interact with patients. But me and my sister, we always call it planting seeds of hope. And that was probably the biggest one. Well, I'm with the Oklahoma Indigenous Nurses Association. So first and foremost is our Native people, to bring visibility to the needs of our people, because we have some of the worst health disparities in the country because of all the historical trauma, generational trauma. So that would be that's my heart, is of course my own people, but at the same time, it's like it should be equal care for everyone. So in that same part, trying to navigate a route to help Native people, but not just Native people, help all of us to have good care, have quality care. And if it means like bringing in programs where we help nurses heal, because a lot of the times nurses are looked over for debriefings. I've talked to my recent coworkers about how do we let go of the things that we can't unsee. There's debriefings for military, there's debriefings for EMS, for paramedics. I don't know about doctors either, but there's not so many debriefings or those coaching sessions, I guess, for mental states of nurses. So all of it combined, I have a lot of goals, I got big dreams. But Native people, everybody's equity, and helping our nurses take care of themselves.